The bladder. There's a lot of things that can go wrong with it. Here's three of them. What's up, everyone? Mike Muellner here. I'm an internal medicine doctor from Los Angeles, California, and today we're going to talk about three very common issues that I encounter with the bladder. These are with patients who are in the hospital setting. So let's jump right in. Number one, probably the most common problem that I run into is the bladder infection. So part of this, I think, is because of the anatomy. If we go over basic anatomy, we've got this little plush bladder here. Not exactly the most realistic representation of a bladder, but still pretty nice. This is from Giant Microbes anyway. Jumping right in, you got the bladder with the urethra at the bottom. That's the tube that you pee out of. And then you got the ureters up here, which will lead up to the kidneys. So the problem is that the urethra ends very close to the ending of the gastrointestinal tract. In layman's terms, that means that the bladder is very close to the place where poop comes out. Now, the bladder is really needs to be sterile. There really should not be bacteria in the bladder. The opposite is true with the gut. You actually want bacteria, and a lot of bacteria, in the gut to help with digestion. The problem is that sometimes the bacteria in the gut can end up in the urethra and then can find its way into the bladder, where it causes bladder infection. We also call this cystitis. Common bacteria are E. coli or Klebsiella. These are also bacteria that grow in the gut. So symptoms of a urinary tract infection, the most common ones will be burning or pain with urination, increased frequency of urination, or sometimes you can have more vague symptoms, like just feeling very fatigued, kind of vague lower abdominal pain. We call this suprapubic pain. And in people who are a little bit older, maybe they have some underlying dementia. Urinary tract infections can very commonly make them very confused. And so you get both common symptoms and then also more vague symptoms. For this reason, we are very quick to check the urine for check a UA, urinalysis, to look for evidence of infection. So in a UA, you'll see things like leukocyte esterase, nitrite. These are kind of indirect indications of inflammation or that there might be bacteria present. But the even better test is urine microscopy, where you look under a microscope and you see if there's any white blood cells in the urine. And so that we call pyuria. That's a sign of inflammation. But perhaps even better than that is the urine culture. This is where the urine is actually grown on a petri dish. We can look for bacteria, not only look for bacteria, but figure out what kind of bacteria is causing the infection, and also what antibiotics that bacteria is susceptible towards, so that it can help guide management. It helps us figure out which antibiotics to use. Now, a big issue with urinary tract infections is that they can actually involve not only the bladder, but they can extend up the ureters into the kidneys. We call this pyelonephritis. So this is a kidney infection, and this can be quite serious. With this, you can get flank pain, fever, and it can lead to what's known as sepsis, or a disseminated infection. You can even get bacteria that find their way into the blood, and this is life-threatening. People can die from this. So that's the thing about urinary tract infections, is they really range in severity from very mild cases. You almost don't even notice it. Certainly don't even need to come to the hospital. Maybe it's just a little burning with urination. You take antibiotics for 3 days, done. They can range from that all the way up to really significant diseases that can land you in the intensive care unit or even be life-threatening. So there you go. That's a quick run-in with urinary tract infections. Now, on to the next issue that I commonly run into with the bladder. And actually, if you'll excuse me, I'm just going to take a little sip here. Yeah, it's perhaps ironic that I got a very much urine-appearing beverage. It's not urine, though. It's the peach monster here. Anyway, next issue run into with the bladder is urinary retention. So this is where the bladder fills, but then is unable to empty. That's a big problem, because if you get too much fluid in the bladder, you know what can happen? Well, supposedly the bladder can actually rupture. I've never seen this happen. I've been practicing medicine for over 10 years, never seen a bladder rupture. But what I have seen is hydronephrosis. So this is where you get backup of urine through the ureters into the kidneys, which can make the kidneys very swollen. And this can actually lead to kidney failure. So how do you get urinary retention? Well, a common way, especially with older men, is with enlarged prostate. So the enlarged prostate, which is right here, it makes it very narrow for the urethra going through the prostate. And then this can cause an obstruction, blockage, urine cannot pass through, and then you get buildup of urine in the bladder. And so yeah, that's probably one of the more common ways. Now, the way you treat this, well, first, the way you diagnose it is with a bladder scan. So a common situation, you get an older gentleman, comes into the hospital, any number of complaints. Maybe it's just weakness, fatigue, maybe some abdominal fullness. You run a quick set of labs. You find out that that individual is in renal failure. Okay, a blood test shows elevated creatinine. Not sure why, so you send a urinalysis. You look for signs of infection, anything that could be causing renal failure. It comes back pretty clean. Then we really got to check a bladder scan, so an ultrasound, to look for how much fluid is retained within the bladder. And if it's more than about 300 cc's or so, then you've got urinary retention. Now, treatment for this involves a placement of a urinary catheter. It's also called a Foley. The catheter goes, you can imagine where it goes, right? And then eventually finds its way into the urethra and then into the bladder. That allows urine to drain and it relieves the obstruction. Now, in addition to a prostate hyperplasia or enlarged prostates, other things can cause urinary retention as well. You can have a neurogenic bladder. One time I remember a case of somebody who had a gunshot wound to the spine, and because of all the damage to the spinal cord and nerves, ended up with neurogenic bladder, and so had chronic urinary retention because of that. It can also just be an issue that you encounter with a prolonged hospitalization or after surgery, after anesthesia. Sometimes the bladder just doesn't empty quite properly. It takes a few days to really bounce back. But this is a very common issue that I encounter in the hospital. And now I'll be honest with you, after working in the hospital for a while, I feel like I'm pretty desensitized to a lot of stuff. Like when I get my blood drawn at the doctor's office, I don't even sweat it. But I'm still sensitive with the idea of a Foley catheter being inserted. In fact, it makes me actually lightheaded when I see the nurses doing that procedure. So that's something that I still haven't become desensitized to. All right, now moving on, number 3. Let's see, what can we talk about for the number 3 common issue with the bladder? I know, blood in the urine. So this is also called hematuria. And this is not normal, okay? So a common situation I'll see is somebody who actually has the urinary catheter in place, and then one day the urine goes from being yellow to being pink. And so that we call gross hematuria. It's blood in the urine that you can actually see. And a common cause of that is just with Foley trauma. Just when you got that tube in there, it can disrupt the inside of the bladder, inside of the urethra. And especially if you're on blood thinning medications like aspirin or warfarin, you can bleed more easily. So you can get this Foley trauma leading to hematuria. But in more severe cases, the urine actually gets dark red. There's so much blood in there, and you actually get blood clots. And so this can cause obstruction. And so this is a situation where I will definitely consult with a urologist. Sometimes they have to put in a special Foley catheter, a larger one that allows for continuous irrigation so you can flush out all the blood until it resolves. Other things that can cause blood in the urine would be infections, cystitis can do it, or a cancer. So tumors inside the bladder can bleed. That's another big concern with blood in the urine. All right, so there you go. There's 3 common issues that I encounter in the hospital setting with the bladder. I hope you enjoyed this video. Thanks so much for hanging out with me the last, I don't know, this was like 5-6 minutes. But if you like medical content like this, feel free to hit the subscribe button there or check out another video here. And I'll see you guys next time.